Jane Grayson's probably off dealing with more important matters.
Oh, well, when's it been any different? You've got two choices. Either bang your head against a brick wall, or you back away from stuff you can't change.
Don't worry. Be happy. Like you.
Yes, I'm happy.
With Ollie.
Don't even go there. Stop worrying about me. I'm not your little girl anymore.
You'll always be my little girl.
Oh, seriously, if I can't look after myself now, then when? You need to stop fretting about whether the guy I'm seeing is suitable, or whether I'm comfortable where I'm living, or what I'm doing when you're not around. I'm happy, okay? Really happy.
There you go.
Right, let's go.
Any sign of my x-rays? Okay. I thought it might have been in the thorax. Let's order a chest CT, please.
Oh, Darwin rang. Left a message for you from a Mrs. Garner.
All right, thanks. Okay. If you carry on, I'll be with you in a minute. I've got to break in a bit. I'll call her then.
Oh, I bought the file and the adoption papers. I thought you might need them.
No, I'm fine. I should go, okay?
One thing, Lucas. Yes, I've been thinking that you've been very good about me adopting Archie and about us.
Mm.
Well, I realise that blood's thicker than water, so...
Where's this going, Joseph?
I'd like him to have access to his son. Official access.
But I told you, he doesn't want it.
No, even so, I'd like to offer him the option again. I think, regardless of me becoming Archie's father, that Lucas is his biological... There's a connection.
Well, why are you bringing this up now?
Well, because if you agree, we need to mention it to Mrs. Garner. Look, if you give me Lucas's phone number, I'll put it to him this time. Might be less complicated coming from me.
I don't have his number.
Well, surely you must have some.
Well, he moved. We communicate through solicitors. Look, can we talk about this later?
Yeah, but presumably you wouldn't have any objection.
I told you already, he's
Look,
not...
the man lives halfway around the world, Faye. I mean, it really is just a matter of principle. Now, he may not want to take it up, but it's important to me. I'd like to at least give him that option.
Right, okay, look, can we talk about it later? Hmm? Please.
Sure.
You all right?
Yeah, I'm fine.
It's just, I thought being back here would take my mind off things, but people keep asking. Yeah, and everything here just reminds me of him.
Excuse me. The doctor said he'd be here, but nobody's saying anything about what's going on.
Yeah, Andrea is absolutely fine. Look, we're keeping a close eye on her, so...
Oh, sorry. Look, sorry. It's just a bit difficult, when just sitting there.
Sure.
I told her this factory she's working in, I told her it's a cowboy operation.
Right.
She had to go up these ladders and put sacks of, plastic in a mould. And there's clamps moving and blades spinning, and there are no guards on the machine. The place is a death trap.
Well, I'll get Mr. Griffin to come and talk to you. Yeah?
Okay, thank you.
Well, hello, Keller. Yep, if you just hang on for a sec, I'll try and find him for you. Okay.
I was meant to say hi. Welcome back.
I'm sorry. The number you're dialing is no longer available. I'm sorry. The number you're dialing is no longer available. I'm sorry. The number you're dialing is no longer available.
No, I told you I don't want you in the house without me there. No, I don't give a damn. No, John. I'm having lunch at 1. You can call me then if you want. Sorry. So,
it was just about the bed thing, really, Mr. MacDonald. I've spoken to his wife, and she's calling off the dogs.
thanks. I suppose you heard all that. Yeah, John and I have split up. Actually, no, he left me. And he's trying to get back in to pick up his stuff.
I'm sorry. You okay?
Sure, absolutely.
Well, you're probably better off without him. Should,
Your sister, is she married or does she have a boyfriend?
No. I just phoned Mum and Dad. They're back in. They live near Florence. Retired. They're on the way over.
All right.
Pulse is 142, BP is 95/60, and she's had 500 mils of saline.
Okay, let's try a liter of warm Hartmann's then. Cross-match 4 units, just in case. There could be some bleeding in there.
Right.
Sorry, you're needed on Darwin, Mrs. Beecham.
Okay.
Hey, look, why don't you come and get some air? Honestly, nothing's going to happen here for 15, 20 minutes, so, yeah?
Yeah, okay.
What's she doing here?
Who?
She's your patient, apparently.
Yeah, and yours, and I can't do anything to fix her.
Because?
Because of the intestinal obstruction. If I put her on bypass, the infection will spread through her body. Do you know what? You can't just transfer patients willy-nilly.
I didn't transfer anyone. You know, God, who do you think you're talking to?
Sorry, can
What?
I ask, is this actually about the patient or an excuse to let off some director of surgery tension?
Huh?
Just saying, perhaps you should wait until one of you actually gets it before declaring war on the other.
Sorry. Excuse me, Jane?
Good morning, Terence.
I'd like to go to the candidates' applications one more time before we begin the interviews, if that's possible.
Sure.
Chairman of the Trust, head of the appointments panel.
Yeah, thank you.
You know, before I would have thought you were a shoo-in for that job, but now, I don't know. Great management skills.
Yeah, likewise.
All right, you're worried about the infection,
Do you know
right?
what? Forget it.
No, really.
Forget
No,
it.
let's get her transferred again. Okay, excuse me. Can we get her packed up, get her transferred down to Kellogg, get someone to sign for it? Not a problem.
I've got the ED referral from Misty, the autistic patient.
Mark probably fouled it. You make the call? Mrs. Garner.
Oh, she was in a meeting. I left a message. If she hasn't called me back in an hour, I'll try her again.
Mr. McDonald's bloods.
Ah, thank you. I was thinking, Lucas.
Can we just leave it until...
You don't have a phone number, okay, so how about an email address?
He's not interested, Joseph. I've tried to get him involved with Archie, but he's just not interested. You're wasting your time. Forget it.
Stay.
Yeah.
You're wanted up on Darwin.
Thanks.
So the doctor in AAU was saying that she has a hole in her heart,
Dear Liza, dear Liza.
as well as this obstruction.
There's an adhesion blocking her intestine.
Yeah, Mr. Cullen explained, but it can be fixed, right?
Absolutely.
And the hole in her heart?
Likewise, but you're best off discussing that with Mrs. Beecham. But can I ask, can she understand enough to give consent for the operation?
No, that's down to me.
Okay. I'd like her on half-hour OBS and a course of IV antibiotics, please.
Sure. The referrals you asked for?
Oh, yeah. Thank you.
She's not been eating for weeks. Not properly. But they only told us about it at the weekend.
Has she said anything?
No, she doesn't. Not about... She's got a very limited sense of herself.
Do you think she's frightened? I don't wish to, but... I mean, just because she doesn't relate to the rest of the world, like most of us, doesn't mean she doesn't feel. You'd recognize the signs, of course you would. I hope I would.
Really? What would you know about it?
I have a son. He's not autistic, but he's in residential care. I do kind of know what it's like.
Oh, Mr. Spence, her pulse is 137 and resp is 25.
How long since she had the Hartmann's?
I'm not sure Dr. Valentine sorted it.
And Griffin's been paged? Is she gonna be okay? Okay, well, the x-rays from the ED didn't show any fracture in the pelvis or chest, but she is definitely bleeding somewhere.
Maria?
Okay, find Griffin for me and make sure that Dr. Valentine order those cross-match units.
Looking for me?
Yeah, Angie Nardi's not responded to the Hartmans.
Okay.
Yeah, she's going into theatre now, Mr. Spence.
Morning. Mrs. Parker?
Yes.
They've kicked off then, with the also-rans.
Mrs. Beecham? Mrs. Beecham.
Oh, who's that?
Sam sent me an email saying that he'd changed his plans. He wasn't coming over anymore. I thought maybe you knew why. Sorry if I tried his mobile. It wasn't